Imagine yourself being confronted with a situation where someone was sick or injured and needed medical help. Help from community members plays an important part in managing a casualty's injuries. They can prevent the injury or illness from becoming worse and preserve life until the ambulance arrives. This DVD will provide important information on how to manage a casualty who has been involved in an accident or requires emergency first aid. For people who are deaf or have a hearing impairment, communication may be more difficult in a situation requiring first aid. This DVD will look at communication tactics to ensure you can help or be helped by a person who is deaf or has a hearing impairment. St. John Ambulance encourages first aiders to follow the St. John Action Plan. Doctors A, B, C, D. Let's break down the plan and look at what is involved in each step. D is for danger. Before approaching the scene or casualty, check for anything that is dangerous to you, the bystanders, and the casualty themselves. Some examples of danger are fuel, electricity, traffic, poisonous gases, and overhead wires. If there is a danger present, do not proceed, as you could become a casualty yourself. Look after yourself. One person is already injured. Wearing gloves will protect you from any infection the casualty may have. If gloves are not available, improvise with clean plastic bags or lunch bags. The next step in the plan is R, for response. Is the casualty conscious? First talk to the casualty. Let's see if you get a response from a verbal command.
Okay, can you hear me? Can you open your eyes for me?
If the casualty doesn't open their eyes, gently but firmly squeeze their shoulder, or ask the casualty to squeeze your hand while asking them again to open their eyes. Both hands should be squeezed if a stroke is suspected. The casualty is deemed conscious if they can follow your instructions by opening their eyes or squeezing your hands. No response, or response only to pain when squeezing their shoulders, indicates that the casualty is unconscious. This is a life-threatening condition and urgent help is essential. S is send for help. This means contact emergency services for an ambulance. If there is a bystander around, ask them to make the call for you and to come back and confirm that they have made the call.
Get back to me when you've done that.
If you are alone, check the casualty's airway is clear and check for normal breathing. Place the casualty into the recovery position and then call 000. If you are deaf or have a hearing impairment and experience difficulty hearing on the phone, you can use the National Relay Service, which prioritizes all emergency calls. There are 5 ways to do this. By TTY, dial 106. By Internet Relay, ask for 000. By SMS Relay, 0423 677 767. By Video Relay via Skype, and by ordinary phone, dial 1-800-555-727 and ask for 000. Remember to check danger and response from doctors A, B, C, D on your return. Next is A for airway. When someone is unconscious, their airway may be blocked. This can be caused by the back of the tongue, foreign materials such as food, vomit, blood, and broken teeth, and injury or swelling of the airway. In managing a casualty's airway, there are always 2 steps. Step 1. Clear the airway. Place 2 fingers onto the casualty's chin and pull the jaw down. Check the mouth and look for foreign matter. If there is no foreign matter found, leave the casualty on their back. If foreign matter is found, the airway must be cleared. Place the casualty onto the recovery position, a stable side position, and manually scoop the foreign matter out. Step 2. Open the airway. To open a casualty's airway, place 2 fingers under the casualty's chin and your other hand on their forehead. Now simply tilt the head and lift the chin. This action lifts the tongue away from the back of the throat. Now the airway is clear and open. The next step is B. B is for breathing. To check for breathing, place your cheek close to the casualty's nose, look down the length of their body, and place the other hand onto the casualty's upper abdomen. Look, listen, and feel for up to 10 seconds. Look for the rise and fall of the chest. Listen for sounds of breathing. Feel for the breath on your cheek and the rise and fall of the chest. For people with profound hearing loss, looking and feeling will indicate if the casualty is breathing. You are looking for a minimum of 2 normal, even, quiet, and effortless breaths in 10 seconds. If the casualty is breathing normally, place them into the recovery position, check their airway and breathing immediately, and then every 2 minutes. If the casualty's breathing is less than 2 breaths, or they are occasionally gasping, then this is not adequate breathing. You are now the casualty's life support. C is for CPR. This step is the management of an unconscious, unresponsive casualty who is not breathing normally. CPR consists of chest compressions, which act as a mechanical pump for the heart, and rescue breaths, which inflate the casualty's lungs. We give 30 compressions at a rate of 2 compressions a second, followed by 2 rescue breaths, each lasting for 1 second. For compressions, place the heel of your hand on the lower half of the breastbone, in the center of the chest. Place your other hand on top and interlock the fingers. Bring your shoulders directly above the casualty's chest. Proceed to push 1/3 of the casualty's chest depth at a rate of 2 a second. For rescue breaths, open the casualty's airway with the head tilt chin lift method. Seal the nose so no air escapes, and then place your mouth over the casualty's mouth and blow for 1 second. Just enough to see their chest rise. Turn your head to see the chest fall, take a fresh breath yourself, and then deliver another rescue breath. If you are unable or unwilling to give mouth-to-mouth, give compressions only at a rate of 100 compressions per minute. Continue giving CPR until the casualty responds by either pushing you away or breathing normally, ambulance officers arrive, or you are physically exhausted. The final letter in the St. John Action Plan is D for defibrillation. An automated external defibrillator is used to treat sudden cardiac arrest. If you are performing CPR and a defibrillator is available, attach the defibrillator pads and follow the machine's prompts. For people with severe hearing loss, an AED with visual or written prompts may be available. If this is not available, a bystander will be able to assist with the audible commands. A defibrillator can increase the casualty's chance of survival significantly, as it may help in re-establishing normality in a heart with irregular rhythms in cardiac arrest. It is important that CPR continues until the AED prompts you to stand clear of the casualty. The AED will also instruct you when to commence CPR again. Remember, if you are faced with a situation where a casualty requires your help, simply follow the St. John Action Plan. If you have noticed that the casualty you are treating is deaf or has a hearing impairment and may be unable to hear you, you'll need to consider alternative communication methods. Write the necessary questions or commands on an available notepad or phone, or use speech recognition to text application if available. St. John recommends that if you need help or are unsure of what to do when dealing with a casualty, then contact emergency services.
Yeah, I've got an emergency. I'm not sure what to do. Can you help?
The communication officer will direct you on how to treat the casualty correctly.
In an emergency, you're thinking on your feet. You can only do what you can at the time. Attempting first aid is better than doing nothing at all. Your help could save someone's life.